Hello, hi, my name's Darren. I'm a clinical pharmacist working in general practice in Newham. So today we're doing a Ask About Asthma campaign. I'll be talking about how pharmacy and general practice can work together, and sort of give you my sort of thoughts and views on how we can work really collaboratively with pharmacy, and pharmacy can have a sort of an important integral role plays in sort of in managing children, young people, and parents with asthma. So I've worked in the community pharmacy previously myself. I understand the stresses that go behind it, but also understand that there's so much opportunity in sort of highlighting and supporting patients and highlighting the importance of good sort of health and well-being. And it's the pharmacists, pharmacy teams, and pharmacy technicians all have great skills, or have the relatable knowledge of their customers, patients that come in day to day. And how I see that pharmacy really plays a great role um, in managing asthma, and how I feel also that they can continue with, is really sort of focusing on the inhaler technique, really educating patients and children with using the right sort of inhalers, choosing the right inhalers for the right patient, and therefore also using the right spaces for the right child. If they're more than five, make sure are they able to use a spacer without a mask, and how that communication go is fed back to the general practice to make those changes, and if they are using inappropriate inhalers or spacers. As part of the new medication service, it gives them great opportunity to really sort of work with children and young people to uh, to really sort of start the patient's journey when they're changing the inhalers, checking how they're using it. Are they getting any side effects? Reassuring patients and really educating them the importance of continuing their regular steroid treatment. I also feel like the pharmacies would be a great place also to sort of pick up on regular salbutamol use. I know that sometimes having that relatable person coming in to collect their salbutamol, but you see them keep coming in, and really to sort of working with the patient to really sort of engage and understand, help them understand what's going on with their poor control, and really working closely with the general practice team and the asthma nurse, pharmacist, or GP, really to sort of discuss the challenges that's going on with the patient, because they may not be attending their asthma reviews, and they may be only be collecting their inhalers from that pharmacy. And also, it will be also good opportunistic ways of working with discussing patients and with patients how to minimize their triggers that might be flaring up their asthma. Working with children and parents working on discussing about dust, air pollution, even indoor pollutions. Look, we're thinking about cooking smoke, incense, having discussions about their home environment involving mold, and where to signpost them to give the right advice. And if there are concerns, how pharmacies can sort of relay that back to general practice. And key self-limiting conditions like managing hay fever really well, optimizing the care of their hay fever treatment, supporting parents understanding how important hay fever management is in the importance of controlling asthma really well, because if the hay fever is not controlled well, which will worsen their asthma overall, really supporting them to use the right treatment for the right patient, and if it and what to do to escalate then how patients and parents can go back to their general practice to really highlight poor control of their hay fever symptoms. And also discussing about sort of other healthcare campaigns they do, community pharmacy, looking at weight, smoking cessation, which is a vital role, an important role in any household. We're really talking about children and young people who are vaping under the age of 18, and highlighting the lung health implications. of them, and really working with households who have parents or young adults smoking, and really working with them to explain the harms that it's causing to the control of the asthma and other health complications, and working with them to find out sort of other ways of managing to and treatments to help them quit smoking. I'm quite lucky in where I'm working at the moment in Newham. We work here. We've had a community pharmacy air quality asthma pilot project, where really pharmacies have really been able to engage with the children and young people with discussing about air pollution and asthma. But this will be further discussed in our next webinar, which will be for pharmacy. So please do join that if you want to know more about it and the benefits that it's having and what it entails. I think from a general practice point of view, where myself and my colleagues are working in to really engage with children and parents, is by checking their inhaler techniques, doing all the work that really community pharmacy are doing, but also really looking at the numbers in our practice and doing audits. We should be sort of focusing on looking at those patients with and highlighting those patients who are regularly overusing their salbutamol, 3 or more. We should be sort of highlighting and bringing forward, and really discussing with parents and and children what's causing their poor control of the asthma. Looking at those children and young people who may have been attending A&E due to their asthma flare-up, and are 48-hour reviews being done with an appropriately trained clinician who can really discuss what triggered off their asthma. Are they on the right treatment now, and are they okay, and really supporting that family through the journey. And also looking at those prescribing frequencies of prednisolone. How are those children and young people who've been prescribed prednisolone in the practice really been followed up for an asthma review, and working with them as well to sort of working with the families and the whole team really on trying to reduce any sort overuse of salbutamol, reduce poor control of asthma, and really uptake the increased uptake of inhaled corticosteroids. As a pharmacist working in general practice, I do conduct asthma reviews, supporting children, young people, managing their hay fever quite well, and also having difficult conversations about supporting in their sort of living environments, tackling mold, supporting parents' understanding of what asthma is, giving them education of the importance of using the right treatment and using the steroids if it is on a regular basis, and why asthma control should be optimized for the child's health, to reduce days off school, to reduce the risk of hospital admissions, to reduce the lack of the children not thriving well. I'm really passionate in working with children and young people, as I know how changes in their child's asthma control can really make a difference in their ability to do PE, to do daily activities, to integrate with and play with their friends, to really push themselves to their abilities. And it's really beneficial where I see parents see the change in how the child is once the asthma is well controlled, and they understand why asthma control and asthma is quite important in managing it for the child. I really find working with pharmacies important as part of my consultations, as I constantly highlight the support pharmacists can give parents and children, where sometimes it can be a bit difficult to get appointments of general practice. But really the support is out there in the community, really sort of emphasizing that they know where to get the information about what to do if their asthma is poorly controlled, where to signpost them to Asthma Lung UK, really highlighting the importance of having their personalized asthma action plan, whether it's in a digital passport, whether it's having it accessible or in the right language, and supporting the parents as well for educational videos, really in their own language, because we have a whole diverse uh, diverse languages in our area, and sometimes communication of and providing that communication is so important so that they understand. I'd like to say thank you for listening to me today, really highlighting the great work that we're doing collaboratively with pharmacy and general practice. Really hard work community pharmacy are doing out there to educate and support children, young people, and parents. And to the clinical pharmacists and pharmacy teams working in general practice to really continue their great efforts and really highlighting and pushing their team members around them to really support the care of these vulnerable children with asthma and the challenges that we do face. Thank you for listening, and I wish a great campaign for the asthma Ask About Asthma 2024.